Welcome back. My next guest is Dr. John Dvorak, who is a colorectal surgeon with CSGA. Welcome.
Thank you for having me, Jeff.
All right, now I say colorectal surgery. Tell me, what are some of the things that you have to operate on?
Yeah, we have a practice that's pretty wide in variety. We do things like colonoscopy, we do minor surgery for people who have problems with hemorrhoids, and we do a lot of major surgery as well for colon cancer, diverticulitis, or people who have major abdominal needs for major abdominal surgery.
Now there's apparently different ways to do that surgery now.
Yes, there is. There's been kind of a paradigm shift over the last 10 years in colorectal surgery, specifically in operating on the colon. Back in 1989, the first gallbladder was done laparoscopically, and all of a sudden we began seeing uteruses removed laparoscopically, gallbladders, appendices. There was a big push into that field, but operating on the colon in that fashion was much slower to be adopted. It wasn't until the mid-90s that a laparoscopic colon was even attempted, and even then it was very difficult to do, and it was very long surgery, and not until the early 2000s when the robotic surgery began to become more popular and used for such things as hysterectomies and prostate surgery. Then it began to be looked at a little bit more seriously for colon surgery, but it wasn't quite there. It wasn't until 2014, roughly, that the robot became advanced enough with some of the latest instrumentation that we have to allow us to do colon surgery. And that's what we've been doing for the last 5 years, and it's been a tremendous advantage for patients. It saves them a lot of pain in terms of a big incision. It allows us to do the entire surgery within the abdomen, so we don't have to make an incision and pull everything out onto the belly, resect the piece of bowel that is diseased, whether it's for cancer or diverticulitis or inflammatory bowel disease, and then put everything back together.
Now we've got a graphic up there that's the system you use. So basically you're playing a video game there and operating on a person without actually being at the table.
Yeah, that is a big change. You know, when you think of surgery, you think of a surgeon standing next to the patient, inside of the patient, very intimately involved. And when we do robotics, we actually are just putting little ports into the abdomen, and the surgeon actually sits over in the corner and does the entire surgery with an assistant at the bedside to change out instruments. And so the surgeon can be off in another room, and originally this was designed to be actually in another location even, but so far we're still in the room.
So what you mentioned, there's a lot of people that do robotic surgery. You mentioned prostate hysterectomies. What took the colon so long, and is it getting more and more acceptable now?
Yeah, that's a great question, and yes, it is becoming more accepted, very much so. In fact, it's sweeping the country. I would say that almost 2/3 of patients who are undergoing elective surgery now are undergoing some minimally invasive approach to that surgery, whether it's a robotic or a hand assist or laparoscopic approach. But the robotic approach is really the one or that procedure is taking the lead and will take the lead. The things that allow us to do it, there were certain technologies that needed to happen in order for this to work for us. One was we needed to have stapling technology. Two, we needed to have an instrument that would allow us to seal a vessel and then divide a vessel. And we needed to have some way to check blood supply so that when we put two pieces of bowel back together, we knew that it was going to be a healthy, well-vascularized anastomosis or a connection. And those things did not exist on the earlier versions of the robot. And it wasn't until all of those things did come, those technologies were included, that we were allowed or able to do this.
And now with the advent where you can do this, it's much easier in terms of recovery for the patients. It's much easier.
Yeah, if we think of open colon surgery, for example, the average length of stay is about 6 days if you look nationally. For a laparoscopic or other form of minimally invasive colon surgery, generally 3 to 4 days. With robotics, we're blowing it out of the park. They're going home in 24 hours, sometimes 48 hours, but most of the time it's about 1 day.
That's great information, and it's great for the patient that you can now do robotic surgery on the colon.
Yes. And they have much less pain, they much less chance of having a hernia, and they get back to their usual lives much quicker than, you know, an open abdomen and a big incision. It could be a month before somebody gets back to work.
Okay. That's great information. Appreciate it. Thanks for coming in.
You're welcome.
All right. We'll be right back.